In France, there is universal health care for people who are legally residing within France, whether or not they are working. Direct from the website of what is called Assurance Maladie. Literally, it would be insurance, sickness insurance, but it's translated as health insurance. So universal health insurance for French people. Toute personne qui travaille ou réside en France de manière stable et régulière a droit à la prise en charge de ses frais de santé à titre personnel et de manière continue tout au long de sa vie. Tel est le principe de la protection universelle maladie. So, everyone who works or resides in France legally has a right to the taking of the responsibility by the state of his or her personal health charges continually and throughout his or her entire life. That is the principle of universal health care. France is a very generous country regarding health care. Now, Tiffany doesn't reside in France, but she is French. So for French citizens residing abroad, that is termed an expatriate, there was and is a way to obtain free healthcare in France. That method would be to pay into a fund for French citizens abroad. Okay, so I'm going to minimize this one, and I'm going to go to the Fund for French Citizens Abroad. By the way, all of these links, I'm going to provide them. I have provided them in the links down below in the description box. So, Caisse des Français de l'étranger. This means the fund for French people living overseas. I'm not going to read all of it, just maybe the first sentence. La Caisse des Français de l'étranger permet aux Français expatriés partout dans le monde de continuer à bénéficier du remboursement de leurs soins prodigués en France. The first sentence basically says it all. The Fund for French Overseas allows French expatriates to continue to benefit from the reimbursement of their medical care promulgated in France. Now, Tiffany would have had to pay into this fund to have universal health coverage in France. She can still do that at any time. I don't know about you, but I think now is about the right time. In fact, it was the right time maybe years ago, but it's never too late now. Now would be a good time too. Why not? So let's go to see how she would do that if she wanted to do that, which I think she should. So scroll all the way down to, where is it? Did I pass it? Okay. Évaluer le montant de vos cotisations. I want to now estimate the amount of the premium. Okay. So I'm not exactly going to click to subscribe to it because this might take a bit longer, but I want to show you how easy it is to do it. Okay, so évaluer le montant de vos cotisations. Well, there are different plans, but the plan that would be perfect for her is this one. Vous avez déjà une couverture locale et vous souhaitez uniquement être couvert quand vous êtes en France. In other words, she already has a local health insurance where she's living, and she would only want to be covered while she's in France. So if I click to learn more about this one, okay. Wow, doesn't that look like Matt? Okay, that was uncalled for. All right, so it's even in English, so she would have no problem reading this, so I'm just going to give her the estimate. Choose her age between 30 and 34. Her marital status, there are only two choices, single and family. I'm just going to choose single. 63 euros a month. Okay, now folks, 63 euros a month is 74 US dollars a month, or 54 British pounds a month. I mean, that is not only excellent, but affordable coverage. This would pay for daily expenses, disability, death. It's excellent coverage while in France. Now, why is it written here for the first 3 months? Pour les séjours de moins de 3 mois consécutifs. Why? Because after 3 months, a French citizen who stays in France longer than 3 months is considered to reside in France, and this premium would no longer be due because the French citizen would no longer be considered an expat or an expatriate. So what Tiffany could do is she could subscribe to this service, and even if she doesn't do this, I'm going to be talking more about her options later on, but she should do this. She should have already done this, and I'm very surprised why no one in her family, none of her friends, ever told her to take this option, a just in case, as a sort of just in case option for second and third opinions. This is very important because it's really affordable. So now the viewer, hopefully also Tiffany, is included within this viewing group and may wonder, why come to France? Well, now I will give you many, many reasons. So let's start with the first one. Let's start with the first one. Okay, so the first one. Okay, the first one is a hospital that is called Gustave Roussy in French. It's not this one. Of course, I will find it. Okay, la protection cancer colorectal. Here we go. Colorectal cancer. À l'hôpital Gustave Roussy. Now, Gustave Roussy, he was a French doctor who, among other accomplishments, he published a 1,000-page treatise on neuroendocrinology, and he was also the first to set up an outpatient clinic for cancer patients. So he was also interested in the study and treatment of cancer. That's a history of how the hospital is named. Now let's go to the practical situation. Cancer colorectal. Why Gustave Roussy in Paris? Well, number one, they also have clinical trials. Okay. Number two, and let's scroll down and I'm going to scroll back up. It is in the top 5 worldwide cancer hospitals. Now, let me take a moment for you to appreciate this. One train ride, a couple of train rides away from Croydon, London, is one of the top 5 hospitals in the world for cancer centers in the world. It was also classified the 4th best in cancer treatment and the 1st in Europe by the magazine Newsweek. So you could say, well, you know, there are different ways to classify things. Even when people classify universities, you know, it's sometimes based on the number of degrees or based on the number of research dollars they have. So there are always criteria in how things are classified. But suffice it to say that if this hospital is classified as in the top 5, more specifically, number 4 worldwide, it has something to offer. Now, the director here is professeur. PR in France is the abbreviation for professeur. Okay, he's not just Mr., he's professeur. He's not just doctor, he's professeur. Michel Ducreux. Okay? He is the head. Now, I've read a bit about his biography. He is very, very, very well-known researcher in the field. He's published many, many papers, but of course I don't want to bore you with all of that. What is interesting though is that it is very easy to ask for a rendezvous. It couldn't be easier, so I'm going to click on it. Demander un rendezvous. Okay. Demander un rendezvous. Now, there are 3 cases. The patient is covered by French system. Now, she would be in between. Let's say she's not covered. In any case, the rendezvous, what is it going to cost her? 100, 200, 300 euros? Come on, she can afford this. Okay, so whether or not she's covered, but she has a right to be covered, and she should really take advantage of that right pretty soon. Patient international, or international patient, or médecin voulant adresser au patient. So this would be if a doctor wants to take an appointment with a doctor. And this is her case, international patient. Let me click on this. Okay, patient international. Demander un rendez-vous en avis, demander un second avis, meaning ask for a second opinion, which would require her probably to bring her entire medical dossier, or dossier, to use the English pronunciation of the French word. So let me click on that. Ask for second opinion, and voila! Miraculously, it is in English. So now, after having navigated through the French, she can go to the English part. It's going to be English, and they give specifics for international patients, and you can request an appointment and go through the process to do that. The cancer types treated at Gustave Roussy: brain tumor, digestive cancer, colorectal, pancreas, liver, childhood cancer, etc., etc. So basically, I don't see what cancer is not included in this. Okay, it's basically everything. So, Tiffany, please, consider coming to France. Make it happen. After you finish your one of your treatments, one of your sessions, after you finish with the nausea, come to France. Make the appointment. Number one, make the appointment. Number two, get Matt to help you with all the accommodations. I could even help, but, he's there. Number three, get your dossier together. And what do you have to lose? Because I'll tell you, what is the worst case scenario? The worst case scenario, I would tell you what it is. That she's going to have a lovely vacation and time in France. That's the worst case scenario. She's going to be eating croissant whenever she wants and not put in the air fryer because it's really not healthy to put it in the air fryer. She could eat one different French pastry a day. She could have very good food. She could walk in the nice parks, see beautiful churches, and that's the worst case scenario. They could tell her, okay, the treatment that the Royal Marsden is giving her is what they would do, and, status quo. That's the worst case scenario, but it's still very good for her because it would answer the question, what if? She will have known that even in a country that is in an institution that's in the top 5 in the world for cancer treatment, top 5 in the world, in her home country, well, her birth country, her home country is the UK, that they would have acquiesced to the treatment she's having and not offered anything else. At least that checks off a box of what if, because I don't think anyone should have any regrets. She needs to do this. I really think she does. Because what if something else? What if they say, no, she should change her cancer regimen. We would give her this cancer regimen. This chemotherapy regimen. We could say, well, she's not in France. Well, there are multiple options. She could come to France every 2 weeks to get a different type of chemotherapy if that's what they will do. Or a lot of these very top researchers have colleagues in different countries that will administer the protocol for them in their establishment in the United Kingdom. In other words, she could have the protocol from France in the United Kingdom at a different hospital, perhaps. So that would be transfer of file. But it's not impossible. In other words, whatever she would be told in France that could be different than the treatment she's having in the UK, this is not impossible. It is within the realm of possibility for her to be following a treatment in France. So that's number one. They could change the chemotherapy regimen. Number two, they could say, we're going to give her radiation. We've got this wonderful proton beam, or whatever. And let me tell you, I'm not done with this presentation. I'm going to talk about radiation and how the French discovered radioactivity. So, the France is not to be neglected with regard to radiation. France, 75% of the electricity in France is generated by nuclear power, which means that France has a lot of nuclear centers. And as you know, when you're using radioactive material, they have to be brought in from, unless they're generated in situ in the hospital, they have to be brought in from these centers. So there's no lack of radioactive material in France. There's no lack of radiation treatment in France. What if she would come back once every 2 weeks to have radiation in France? And what if they say they can do radiation on it? Thirdly, what if they say they could do surgery in France? Because I'll have you know that in France, even as of 7 years ago, they are replacing entire carotid arteries with PTFE, polytetrafluoroethylene polymers. Now, I'm not going to discuss that case now, but this is something to do in France. So, the worst case scenario is nothing changes, but she has a wonderful vacation in France. Wonderful vacation. And she relaxes, and at least her mind will be calm and there's no more what ifs. Because she has an opportunity, unfortunately, that many people don't. She is literally a few train rides away from Paris. She can take a rendezvous. She will pay the couple €100 it takes for the rendezvous, and then she will apply for the French healthcare, pay the premium, pay the monthly premium, get your French healthcare, be happy. And once they find out, if she takes a rendezvous, once they find out she's a French citizen, they will be more than happy to help her get her paperwork done because they know she's in a tough situation now. Okay, so they are equipped to handle international patients, and this is so easy. I know a lot of people in the comments have said, well, she should go this. This is doable for her. I'm giving her something doable, something within her reach for many reasons. Location, the fact that she does not have to get on an airplane. She can, in fact, she shouldn't get on an airplane. I think she should come by rail, and she will have a wonderful time. And I really hope she comes to France. Now, this isn't, so that's my pitch. Now, there are other reasons to come to France. Now, first of all, I want to talk about something else. I want to talk about now, not the endocrinology treaties. Why? Now, there are many centers in France also that do what? That have a specialization in genetic testing. Not just genetic testing, but of cancers that are hereditary. There are 7 centers that are associated with cancers that are hereditary. And so it's very advanced. So this is one of the hospitals here. Hospital Georges Pompidou. Actually, HEGP is basically a hospital. It's for liver, gastroenterology, and digestive cancer. So imagine a whole hospital devoted to digestive cancers, right? Georges Pompidou, by the way, he was the president of France from 1969 to 74. Okay, so that's one. The second, there are 7 of these hospitals. Okay, the other one is Hôpital Avicenne. Avicenne, named after Ibn Sina, who was an ancient Persian doctor who wrote basically an encyclopedia of medicine, if you will, of healing, that was in use until 1650. And Avicenne, he was born in 980. So he wrote something that was used for over 1,000 years, for over 1,500 years. So this is the hospital named after him. There's another one, Hôpital Cochin. Cochin was a Catholic priest in France. And finally, last but not least, we have a powerhouse. Hôpital Curie, Institut Curie, the Curie Institute. The Curie Institute. Now, Marie Curie was of Polish origin, naturalized French. She married Pierre Curie. Together, these two did what? What did they do together? They discovered radioactivity, along with Henri Becquerel. Yes, Henri Becquerel discovered radioactivity, along with Pierre and Marie Curie. Marie Curie and Pierre Curie, they discovered radium and polonium. Okay, and in fact, to this day, the basic unit of radioactivity, I want to show you where it is. Where did it go? I know it, but I want you to see it. I don't know why it's not showing up. It isn't showing up. For some reason, it's not showing up. But basically, 1 becquerel is 1 atomic disintegration per second. 1 becquerel is abbreviated BQ. And maybe it's here. Here it is. Okay. 1 becquerel is 1 atomic disintegration per second, and 1 curie is 3.7 times 10 to the 10th becquerel per second. Now, these are the units of atomic decay. Okay, of the rate of radioactive decay. Is named after French. Okay. The French do have their say in radioactivity because they should not be underestimated. To see what these people look like, just for fun. This is Henri Becquerel. I believe this photo is from the 1800s. Henri Becquerel. Marie Curie, and all 3 of them together in the laboratory. Note that all of these 3 together won the Nobel Prize in Physics. And Marie Curie, here, She was the first person ever to win two Nobel Prizes in different disciplines, one in chemistry and one in physics. So, you know, the French, they used to discover things. What can I say? They used to discover things. And just so you also know that the father of modern chemistry, does anyone know who he is Antoine Lavoisier. Lavoisier was the father, here's how you spell it. Antoine Lavoisier. Lavoisier was the father of modern chemistry. And who was the father of microbiology, of modern microbiology, was Louis Pasteur. He discovered what? Microbes. He discovered the existence of microbes, and he called them man's little servants. So, you know, Tiffany, you have a gold mine in France. You have the chance to come to France. You have the chance for a second opinion. Please, I don't understand what is the hesitation and why you haven't done it. I really feel that you should do it. I feel that you should leave no box unchecked. And by getting a second opinion from a hospital that is classed in the top 5 worldwide cancer centers, I think it would make you feel better. You know, whatever they say, whether they say, okay, continue the RM treatment, you know, that's what we would have done too, it will make you feel better. And if they say no, we have something else, we think it should be done another way, then you'll have a decision to make. But of course they would back whatever they're saying with data, with experiments, experimental results. I mean, what they say would be, how should I say, would be not without reason, not without research, basically, not without research. So I think that the process for obtaining a rendezvous is very simple, and I really think that you should make an appointment with the Hôpital Gustave Roussy in Paris. And I just have to say, when are you coming to France, Tiffany? If you come to France, I promise I'll buy you a Dubai chocolate bar. You know, I saw them today at the market. They were only €9 for 200-gram bar, just like the one you and your sister were munching on. Well, munching is politely saying, because you guys are really stuffing it in your faces, but and I think you got ripped off with the price because the price really went down on those. But anyway, please consider coming to France. Not only consider, just do it. Just stop thinking about anything, do it, have a little vacation, but get the rendezvous in France and then work everything around that. Get the rendezvous first, okay? And I feel you will not be disappointed because, like I said, worst case scenario is you have a very, very good trip and very relaxing time. So, bon voyage, bienvenue en France, and I hope you come to France.